Life in a world that keeps changing. Think that it's progress you're making.
Hello friends, welcome back to NHSRN. Today we are going to discuss about catheter removal. So let's see what are the stages, how we can do catheter removal in Osce exam. Catheter removal is 12 minutes stage. Yeah, this station it takes 12 minutes. So whenever you prepare, try to prepare in 8 to 10 minutes. Okay, this is a little bit easier than before. So let's go to the steps. First of all, same, always you want to wash your hands or gel your hand. Always first of all hand gel, okay, hand hygiene. Then you need to make sure that safe to approach, area is safe to approach, safety. Then you need to introduce the patient, who you are and why are you here. Okay, so you can say the patient that hello, my name is this, I am your nurse today, or I am looking after you today, and I'm here to take your catheter out. Then ask the patient consent, is that okay? Yeah, patient would say yes. Then what you need to say, it's you need to explain the patient very well, so that helps you and your patient understood what is going to happen, so patient bit more comfortable and you can do the procedure very easily. Okay, so you can say to the patient that removal of catheter shouldn't hurt, although you may feel slight pulling or you may feel some urinary retention, or you may feel some little discomfort when I take your catheter out or when you pass urine. So you can just explain a little bit informal way, so that helps the patient to understand what you're going to do, or what happened after the catheter removal, things like that. Okay, then ask the patient consent, can I proceed it or am I okay to do it? So just ask the patient consent, is that okay for you? Then you need to do three-way checks. You know how to do three-way checks. Three-way checks are, I have already explained in my previous video. Just go and watch the video, that helps you a bit more information. Then three-way checks, you need to ask the patient what is the patient name, then date of birth, and then you need to check the patient wristband with documentation. Okay, so you need to do the three-way checks. Then you can ask the patient, what would you like to be called? That also you can ask the patient. Then you can check your patient allergy. Always check the patient allergy. So if the patient is allergic, make sure that patient has a red wristband. And sometimes if they didn't record in the documentation, if the patient say I am allergic to this, then you need to document it and ask the patient, when you had that tablets, what happened? Maybe sometimes patients say I had a short of breath or itchiness or I have rashes. Then you need to document it and let the doctor know about it as well. Okay, then you can ask the patient, just tell the patient that I'm going to prepare everything and come back in 1 or 2 minutes. Here is a bell, then you can press the bell if you need it, or give me a shout, I'm here, I'll come back to you. Okay, make sure that patient is comfortable. Then you need to hand wash or hand gel. I would prefer hand wash. Throughout the procedure, at least once hand washing is good practice. So just to do hand wash on that time. So then after you hand wash, put an apron and a pair of gloves. Okay, because this station is the same place, you are just turning back, so you don't need to move any other rooms and come back. So just put it there. Okay, put an apron, put a gloves. Then if it is different, just then assessor will tell you that you need to put an apron and gloves in a tray and come back to near to the patient. That's all about how the scenario and how the situation is. Okay, Usually you are preparing everything near to the patient, you don't have a separate room. Okay, so I hope you got it. Then you put everything, and you need to make sure that a 10 ml syringe in your tray, an apron, a pair of gloves in your tray. Then always you need to say each item is clean, intact and in date. So you need to say each item is clean, intact and in date, means expiry. You have the all the article has a expiry date. So then you need to return back to the patient and to draw the curtain and say you need to provide the patient privacy. So you need to draw the curtain, and again you, after you draw the curtain, you need to gel your hand. Before and after the procedure, always gel the hand. Okay, don't forget that. Then explain to the patient that I am back, so is that okay to proceed your catheter out, taking your catheter out? So then tell the patient that I will uncover you minimally so that I can see the catheter. Is that okay? Okay, so you just uncover patient minimally. Okay, then you need to put on sterile gloves and apron, and be careful, you only expose the area required. Okay, the particular area, you can't remove all the sheets. Okay, then you need to empty the catheter balloon, that always 10 ml syringe, and remove the balloon with a syringe, that usually 10 ml. Then remove it, then so that time it will deflate. Then you need to tell the patient, okay, I'm going to remove your catheter, but I mentioned it shouldn't hurt. Okay, so just remind the patient that, oh, I already told you that it's not going to give any pain. A little bit, sometimes a little pulling, feeling like a full pulling. So you just remind the patient, okay, like I already mentioned, it shouldn't hurt. Then ask the patient, take a deep breath. Okay, so when the patient exhale, slowly remove it. Yeah, then don't forget, like all things, the catheter bag, syringe, everything together, you need to put it in clinical waste bag. Okay, so you need to make sure that all things together, put it into the clinical waste bag, and then gel your hand, cover the patient. Don't forget that, that's the important thing. Cover the patient, gel your hand. Then you need to tell the patient it's all done. I would like to recommend you to drink at least 2 to 3 liters of water a day. Okay, so when you go to toilet, please let me know, and if you have any pain, please let me know, or if you don't pass urine at least through for first 4 hours, that's also you need to let me know. Then you need to use your nursing skill and tell the patient that we need to monitor patient is passing urine okay, or good amount of urine passing. Patient is passing a good amount of urine, or a patient having a retention of urine. So we need to monitor that. That's why we are giving a health education, that you need to drink 2 to 3 liters of water, and you need to make sure that you passing urine. And initially we usually measure the urine, but it's not possible in Osce, but so you need to explain everything to the patient. Okay, then give the bell to the patient and make sure that patient is comfortable. Then you need to tell the assessor that I will document the procedure now in the patient record according to the NMC standard. So I hope you understand everything. If you have any particular doubt or anything, just put it in the comment and I will get back to you. So if you want me to make some particular thing about Osce video, please put it in the comment. If you like the video, please subscribe my channel and press the like button. If you don't like it, please put your comment in my comment box so I will improve my videos. Thank you so much for spending time with us. Have a great time. Good luck with your exam.